happy people tend to be less sick, right? Happy people tend to be less depressed. How many happy, depressed people do you see walking around? You don't see that very well. You don't see this. It's not an absolute rule. There's always an exception to the rule. But that's what you've noticed. So we're always going after that. We never ignore that. When somebody comes in, they're always a walking body attached to a head until the person says, I don't want you to deal with my head. Processed foods, sugar. By the way, also think about the links here. I haven't talked about the direct relationship, but the indirect relationship. If someone's not necessarily as happy, they're also not exercising. They're also eating lousy. They're doing destructive behaviors at the same time. Smoking, obviously, and heavy metals. A lot of things that cause overlapping. The sugar. Sugar's a big one. Craving the sugar. If you crave sugar, and I'm not talking about when you're 15 or 20, somewhere after 30, 35, if you crave sugar, this is what's happening to you in a pinch. You're actually causing your body to go through a stress reaction. It's saying, red alert, I'm in trouble, so it craves sugar. Your body would rather eat up your muscle to make sugar than take away the fat when that happens. So every time you crave sugar, what your body's really doing is eating up muscle and storing fat. And that's the bulk of most people, especially if you're going through menopause or andropause. It's a heightened response. Stages of blood sugar problems. This is not necessarily the exact combination. In other words, it can be a little later. So low blood sugar, 20 years old, very common. This is actually more so you see in females. Then you have what's called insulin resistance. We're not going to go too much. One of my talks is strictly on diabetics and blood sugar, so we're just going to kind of review this. Then later on, we have something called high blood sugar. And all the time, you're losing muscle and gaining weight. The worst thing you ever want to happen to you when you're 40 and 50 is the loss of muscle and increase in fat, whether it's the outside fat or the inside fat that's in the tissues. And then diabetics. By the way, here's an example of a name you don't want to be attached to. Diabetes. When they call it adult-onset diabetes, it's amazing now we're seeing kids that are 5 years old and 6 years old with adult-onset diabetes. So it's not so adult-onset. But we're seeing actually something really interesting. We're seeing people actually say, well, I've got diabetes, and they're using that name as something as if it's external from them. We use names to almost take it away from us, when in fact diabetes really means not enough exercise, too much stress, too much crap disease. And that, medical lingo there. And if you get that, if you treat it that way, you would actually treat something. But if you just treat diabetes, well, I go to diabetes, I just take a medication for it. And that's not right. Sugar accelerates aging. You want to increase the age of an animal in a study, you just give it sugar. Increases inflammation, damages to cells. You get more wrinkles. This is actually used if the females say, well, I don't care about my heart disease and I don't care about my osteoporosis. I'll say, well, you're just going to get more wrinkles. Somehow that seems to work. I don't know why, but I'll do whatever I got to do. I'll use my research for the power of good here. But all that stuff, same thing. More damage, more disease, fast aging. Diet. And I'm not going to talk exhaustively about diets. I'll talk about one main one I like. 1/4 of our vegetables consumed in this country are eaten as French fries, so we know we're not necessarily doing things with diet. But this is a Mediterranean diet. And why I bring this one up, because it was one of the few studies that it was the largest study they did. It was the largest study. They studied it with 1.5 million people, making it the largest study. And what was interesting about it, they did it in the context of anti-aging and disease prevention. So the findings, it gave it 6% reduction in the rate of cancer, 9% less likely to die of a heart disease, 13% less likely to die from Parkinson's. The Mediterranean diet. And basically, it's just a lot of vegetables, beans, fruits, nuts, whole grains, fish, moderate alcohol, once a week, twice a week, red wine, lots of olive oil, and lean meat, and not a lot of red meat. In fact, very rarely do they have red meat. And that's the diet. And that one is actually, again, one of the few diets that has been shown to actually reverse disease or lower down the occurrence of disease and also increase relative health. Exercise. Just going to put one slide just to show you what the opposite of exercise is. Laziness costs BC up to $650 million a year. This was in the province several years ago, 2004. I put it in here because it's a nice example of thinking $650 million. You could knock down people's taxes for that. You could give them a tax break. You could buy some memberships for that. It's unfortunate that we don't have a machine that can help actually provoke people to actually better living. We have to pay it this way. We're always thinking it's costing us on the disease front. And it's unfortunate because we know that prevention pays and we know that prevention saves. But we're always spending a lot of money on this analogy of, if you think of a cliff where people are falling off, the old cliff, people falling off, we're spending money actually buying the latest and greatest ambulances, but we're not just putting up a cheap sign on the top that says turn the other way. Okay, so it's amazing. Prevention is like that. So some of the summary. Oh, we're moving quicker. Free radicals, inflammation causes disease. Increased weight causes inflammation. Extra inflammation causes weight. Inflammation causes more heart disease, more diabetes, more Alzheimer's, more Parkinson's. Poor diet increases inflammation, and inflammation actually causes decreased aging, fast aging, and also stress causes inflammation. So a lot of things cause inflammation, free radicals. It doesn't matter which one you pick because they're all aggravating each other. It's not just one thing. So moving into the hormone section, the truth about hormones. Now I'm going to say something right off the bat. This word hormone has a very scary meaning to it. But without hormones, you would die. That's the bottom line. And so when I use the word hormone, what I'm meaning is what Mother Nature gave you to use, or what actually you have had genetically for thousands of years in your body to use. And I don't mean the levels necessarily, because there's a reason why they decline faster now in our environment than they did before. So when I use the word hormone, I'm not talking about a drug made to look like a hormone. I'm talking about what your body used. And it's unfortunate because when they're using this, even in this Time magazine, they weren't talking about a hormone, they were talking about the drug. So it's amazing when they say hormones are bad, you watch because they're usually talking about a drug that caused a problem. So our hormones decline as we age. Does that seem to make sense? Okay, how about this one? We age because our hormones decline. Quite a difference. And that's the truth. Do you ever want to see a person age very fast? What come the first 5 years around menopause? The skin starts changing, face starts changing, the position starts changing, the posture starts changing, the memory starts changing. A lot of things change in a very rapid period of time. And it's not that our body was not genetically programmed to have hormone levels throughout its entire life. It is. However, with the environment and the stress and the pollution and the sugar and the diet, what we have is we end up exhausting our reserve ability to make the hormones that were supposed to last us for the rest of our life. So if we were all living in a desert island eating perfect food and perfect water, you would have hormone levels at a very high level in your first half of your life and at roughly 75% of that in your second half of your life, exactly what your body's meant to have. So this concept that we're supposed to just suffer and have no hormones, that's not true, because there's 3 organ systems that make hormones, and that means genetically you're supposed to have them. But we actually get exhausted in them. We'll show you why that is. So just go through what is a hormone in the first place. They're powerful messengers. They circulate in the bloodstream. They go to a specific cell. They generate a response. And there's over 100 hormones that we know about. Again, if you did not have them, you would die. Just to give you an idea, a hormone and a neurotransmitter is like a hormone except for the brain. And an odd little piece of tidbit for you, all the neurotransmitters that are in our brain, serotonin, things like that, are also found in our stomach. Now why that is because when we feel stress here, we also feel stress here. Kind of makes sense. Our body wants to prep us for the stress. So we have a hormone, and then we have something called a receptor. So this could be a brain cell, could be a bone cell. Think of it for osteoporosis as a good example for females. Osteoporosis, a bone cell. So we have a hormone, say estrogen or progesterone, goes onto the receptor in that cell, and then its effect is to make more bone, absorb more bone, eat more calcium food, keep the potassium in there so you don't compete with the bone, grab for protein. In other words, multiple effects from a hormone, which, by the way, is very different from a drug. A drug has single effects on one target tissue for the hormone, whereas a hormone has multiple effects on multiple target tissues. That's why drugs are kind of interesting. They work really well for what they're aimed for. They buy you time, but they're not specifically supposed to be used your whole life because they don't act the same way. You understand why it's not like we don't have the technology to make a drug that looks exactly like a hormone. It's just that if you're a drug company and you want to make money, you have to call it your own so you can say it's mine and my invention. So you always have to take something that works like a hormone and actually change it slightly. It's that slight change that actually causes us problems. So one of the main hormones, cortisol. Cortisol is a hormone that's highest in the morning to wake you up and lowest at night to make you go to sleep. Thyroid sits right here, controls metabolic rate. It also controls how you think as well too. You want to lower thyroid in a person? Watch, you'll have less oxygen going to the tissue. They won't think as well. They won't feel as good. And they'll gain weight. And infertility and miscarriages as well for females. Progesterone, that's the cornerstone. That's one of the main mother hormones. And your adrenal gland makes progesterone. Adrenal gland is the gland that controls stress. You have 2 above the kidneys. And adrenal glands makes progesterone. And why I bring this up is that adrenal gland actually makes 40% of a female's progesterone before menopause. So that means that after menopause, when the ovaries go down, your adrenal gland is supposed to take over and make 40% of it. Unless, of course, you've been burnt out and stressed, like 95% of the population. Who here has no stress? Just checking. Okay, testosterone, estrogen. Guys make estrogen just like females, except that they only make about 10% of what a female makes. And females make testosterone, but only about 10% of what a guy makes. And human growth hormone. This is a real controversial one, but it's not so controversial in the clinics that use it. I think I've got about 25 patients currently on it now. I've been using it for several years, and I like it when it's tested. That's the problem with hormones, is that if you don't test and you don't follow up and you don't see how that person reacts to the hormone as opposed to somebody else, then you're really putting yourself in an irresponsible position, because anybody can react differently to any hormone. In fact, from one female to another, one female has up to a 1,500 to a 2,400% difference on how you're going to use that hormone. Because remember I talked about if a person's in an environment of stress or environment, if I give you the hormone and you're in an environment of stress, your body's going to do something different with it than your body if it's different. So it matters that you test. Bottom line, test, test, test. And also test to see what you're doing after with it. But human growth hormone helps all the other ones work. It's the one that restores. It's the one that's highest at night to make you repair all the damage you did in the day. Another thing about human growth hormone is that it's suppressed with cortisol. So if you have high cortisol in the morning to wake you up, and you have low cortisol at night,